Okay, I had fixed your lumbar spine several months ago, 5, 6 months ago, and that was fine. But you also had a upper thoracic back pain issue. Can you briefly tell me the 5 years you've been suffering with that, and describe your pain, and tell me what's been happening with your upper back?
The problem was between my shoulder blades. I could not lay down flat on my back without having sharp pain, and I wasn't able to take a deep, full breath without pain. I actually had a hard time taking a deep breath at all. And I got used to the pain being there, but needed, relief. It was interfering with my work. I couldn't push anything away from me, not even a bag of groceries on the counter. And I found it hard to pick up a bag of groceries. I found simple things very difficult to do. Picking up a hose and coiling it, everyday activities, and even putting on a shirt that required it.
Especially weight-bearing flexion, bending forward.
Yep.
Yeah. And you had some radiating pain into your back of your arms, down to even to your hands, right?
Yeah, and it went into my arms and into my fingers. It was tingling at times, but then sort of a feeling of no strength. Just a lack of strength all of a sudden in my
You
arms.
get instantly weak. It just almost like magically. It's almost like when you go to lift something, instantly you lose your strength. That's a reflex. That's a reflex action to the stretching of those ligaments, and the pain causes you want to withdraw. But if withdrawing is the opposite of the action you're doing, the action has to stop because it's the opposite action, and that's very common. It's a profound weakness, instantaneous. That's why people fall sometimes, because their legs give out with lumbar problems. But this was a different problem, but you've had it for 4 or 5 years, 5 years, I think.
Yep.
Had you been to a doctor about this?
No, in fact, I got used to the pain and failed to mention it when I go in to see the doctor.
And it was pointless. Well, did you feel it was kind of pointless at times because they couldn't do anything for your low back, and it's basically the same thing?
Yeah, actually, I felt helpless, but I do now remember mentioning it to my general physician at one point, and she suggested that they give me some muscle relaxers, and that it should resolve itself, that she thought it was just stress.
5 years?
Yeah.
Yeah.
And
well, it had plenty of time to get better and didn't.
Yeah, I didn't feel that she had a very good gauge of what I had.
A grasp of what was going on.
Yeah.
Is there any doubt in your mind I have a good grasp of what's going on?
Yeah, you definitely, understand exactly what's going on in there, because
so you approach
that time that we spent, I'm unable to move my hands without that feeling of my fingers being numb.
Right.
And I can shrug my shoulders and take a deep breath.
We're getting a little ahead of ourselves because anyone listening to this doesn't know that 10 minutes ago I had finished a maneuver on you in my room where I do my manipulations with my equipment. And what did it take us? Maybe a half an hour? And you felt the crunchy changes as your pieces of disc material were recentralized.
Right.
In each stage of the maneuver. And prior to that, you were in extreme pain, and right now you don't know how to accept the absence of pain. It's so weird. It's such a strange sensation.
The ability to breathe as deeply as I can right now is foreign right now, but I welcome its return. I've always breathed very deeply until that occurred. The heart, the pain started years ago, and I thought that it would always go away on its own. It never did.
Your pain was a little more to the left side.
Correct.
Just as a note, in 2 instances over the last couple years, I've seen people go to the emergency room with that very problem, left-sided chest pain, difficulty taking a breath, and they got $40,000 workups in the emergency room, and I was able to fix them in 20 minutes. And the emergency room doctors and other doctors didn't have a clue as to what was wrong or how to manage it. That wouldn't surprise you, would it, if to hear
Not
that?
at all. I had anticipated going into an emergency room at first. I didn't realize what was going on, but when I sat there and thought about what I was actually feeling on one occasion, I realized that my heart's not doing anything different. It's beating, the same beat, and I just had a lot of anxiety over this slight paralysis in my hands and the pain in my back. But I remembered it had been there for a while.
Is there any doubt in your mind that what I did just took you out of pain? That it wasn't coincidence, it wasn't good luck, or
Definitely.
it wasn't hocus pocus, and I didn't do anything invasive. I didn't give you a shot. You're not under any drugs. In fact, I didn't do anything that was painful. This was a
Right.
completely pain-free experience. In fact, the very second we started with the maneuver, you said you felt a click, and it had relieved some pain at the very outset.
Correct.
And I believe was able to show you exactly which spinal level was the problem, because I could feel your spine and show you the area that was hurting so bad. You didn't have to tell me which area it was.
Right.
I went and found it because I could tell by my experience and technique where you were having your pain.
Right.
Do you now, I want to bolster my ego a little bit. Don't you find that amazing? I mean, because you've been through a lumbar problem for years, 30 years, and this one for 5. And in 20 minutes, you're out of pain in something that you've been in pain for 5 years.
Sure.
Can you tell me why there isn't a line of people around my office waiting to have me do the same thing to them? I don't get it.
I believe that people don't understand how their pain, whatever it is, especially in their back, could be relieved by anything other than what they think of
The conventional medical
conventional.
practices have to offer.
Right, including drugs, which is the most common thing people seem to tell you is they take a drug for their pain.
Now, you've been to doctors about your lumbar spine. They basically represented to you that they could help you. You went there with the expectation that they could help you.
Correct. Yeah.
Thinking back on it, now that you've had 2 areas of your spine fixed, didn't they misrepresent themselves and take money under false pretenses? Because they didn't explain to you what was wrong with you, did they?
No, actually they were addressing what I said hurt the most, and they used modalities that were more palliative than anything.
And they really gave you no indication they understood what was wrong with you, nor could they fix it.
Right.
But yet they took your money, didn't they?
Oh, yeah.
Do you know how many people, how much money is being spent on back pain now by people who are taking money from people just like you under false pretenses? It's in the tens of billions of dollars a year, because the standard understanding of back pain is escaping them. They do not understand what I understand, and it's simple to fix. Now, would you think that you could have watched a video to have, like years ago, if you didn't have access to me, if a video showed you how to hang and turn and twist, do you think you could have put your back in with my technique if you understood the mechanics of it?
I believe so.
Because it isn't that difficult, is it?
Right, it's not that difficult. And I think with good video instruction and maybe, just taking the time to understand what it is you're trying to do and the dynamics involved, you can do it.
I didn't do anything magical or special or whatever. I mean, the knowledge is what did it, knowing when to stretch what ligament. It's a sequential, exact kind of mechanism, but it worked at your lumbar spine and it worked at your thoracic spine. And if it works on any level of your spine, there's no reason to believe it isn't able to work on every level of everybody else's spine.
Sure.
It's because I've taught you the mechanics of the disc, and now you understand it. You actually were doing some fixing of your neck yourself, weren't you? Based on the same principle?
Yes. Yeah.
With some level of success, haven't you?
Yep.
Did you fix your neck? Or
Not,
largely?
Not completely, but I believe just through exploring it more, just
Mm-hmm.
a little bit more, I could probably do that.
Well, if you can't, come and see me. All right. Thanks a lot.